Hello everyone, my name is Milagros and welcome to our group nurse case management presentation on acute migraine exacerbation presented by myself, Doris, Gabriela, and Samantha.
CG is a 57-year-old Filipino female whose primary language is Tagalog. She can understand English but cannot speak it fluently. She is single, has no kids, and has never been married. She lives with her eldest brother and his family in a single-story home. The family of her brother consists of his wife and two adult children. The wife of the brother is her in-home supportive service provider. She has no social supports besides her family, since she spends most of the time at home. She is unemployed due to her having Down syndrome and relies on supplemental security income and Medi-Cal. She was admitted to the hospital due to an intractable migraine that has lasted for 72 hours. Her past medical history includes gout, overweight, and prediabetes. The nurse case manager identified the priority problem for CG as being impaired self-care. CG is able to perform basic ADLs. For example, eating, bathing, toileting, getting dressed, getting in and out of bed, and getting around inside her house. However, she is unable to do many IADLs. Examples of IDLs are grocery shopping, money management, medication management, telephone usage, preparing meals, laundry, housework, getting around outside the house, or having to use transportations to get to places. IADLs are more complex activities that are related to the ability to live independently in the community. When CJ experiences migraines and gout flare-ups, she has to rely on her IHSS provider, who will assist her with ADLs as well as IADLs. Before CJ can be discharged from the hospital, there are issues that have to be addressed. First, there has to be a transition to a new IHSS provider. Her current IHSS provider is her sister-in-law, EC. Both her sister-in-law and her brother have acknowledged that they can no longer provide the best care for CG due to their own health comorbidities. Additionally, education about migraines and treatments has to be provided in Tagalog. Patients and families with limited English proficiency have difficulty navigating an English-dominant healthcare system. As a result, many patients with health comorbidities are unable to be proactive in their health with medication and treatment compliance. Since education is not provided in their preferred language most of the time, or an interpreter is not available.
Patient discharge destination is back home with a new IHSS provider. Her brother and sister-in-law stated that they need help with ZG's care and explained that they are no longer able to manage her care alone. As a result, a new IHSS provider will be needed to assist the patient with ADLs and IADLs, such as managing her medications, education, and driving her to doctor's appointments. Normally, the patient is able to perform ADLs to manage her basic physical needs, including grooming, personal hygiene, dressing, toileting, feeding, ambulating, and transferring. However, with her existing disabilities, she is not able to do many of the IADLs, which are more complex activities that are related to the ability to live independently in the community. For example, she is unable to cook for herself and perform other IADLs that she's not able to carry out, including managing finances, medications, and transportation, as she does not know how to drive. However, her ability to perform simple ADLs are limited when she has acute exacerbations of her migraines. So, The goal for her care once she is discharged home is to prevent these recurrent episodes with more close management. NCM strategies identified. This can be broken down between two levels, patient level and system level. The NCM strategies that will be used in ZG's case will be managed care by planning and coordinating discharge, partnership by supporting her transition to a new IHSS provider, education by teaching ZG and her caregivers about her migraines and treatments with a Tagalog interpreter, and communication by advocating for ZG and her caregivers with her healthcare team. Patient level NCM strategy. To assess health literacy level of patient and family, collaborate with interpreters and give written education in their preferred language of Tagalog, and education will be individualized to ZG's condition and environment at home. Most individuals with Down syndrome have mild to severe intellectual disabilities, as well as disabilities in social functioning. Additionally, psychiatric problems can affect the adaptation of these individuals. Given that ZG has Down syndrome, it will be important to assess her level of health literacy and self-management skills. Once health literacy of patient and family is established, education can begin. Moreover, the educational materials provided will focus on migraines and gout, as well as any red flag symptoms associated with these diseases. Any new, unusual, or worsening neurological symptoms should be reported to ZG's primary care physician and headache specialist as soon as possible, and she must be evaluated right away. In addition, educational materials will also include healthful tips regarding proper nutrition and exercise that can help her achieve a healthy weight and ultimately prevent obesity and its health-related problems. Finally, complementary alternative therapies such as coenzyme Q10, riboflavin, magnesium, feverfew, acupuncture, and biofeedback will also be counted in the educational materials for her to consider as additional prophylactic treatments of chronic migraines.
Since ZG's current IHSS provider is unable to assist her with current needs, she would need help transitioning care to a new IHSS provider. ZG also needs durable medical equipment like the Nerivio Migra device for treatment of her acute migraines and a walking assisted device due to the disabilities caused by her chronic illness. Collaboration between all the members in the multidisciplinary team is required to be able to provide the requirements needed for a safe discharge home. For utilization review, the patient's care requires review of hospital documentation to ensure that clinical guidelines have been met. Documentation would have to be consistent with the plan of care with justified criteria for the needs of the medical equipment and the home health assistance. Once documentation has been reviewed, then the approvals for the health services can be set up prior to discharge to ensure a smooth transition home. For quality and safety issues, the patient-centered care would include understanding the patient's concepts of pain and suffering. For teamwork and collaboration, it would mean to foster open communication to achieve quality patient care. For evidence-based practice, it would be to base the individualized care plan on the patient's values, clinical expertise, and evidence. For quality improvement, it would be to monitor the outcomes of care to ensure that quality care is being met. And for safety, it would be to ensure a safe discharge with appropriate in-home durable medical equipment. And for informatics, you would use that to coordinate the patient's care for referrals and for the home health aid assistance.
Nursing case management effectiveness at patient level. The main NCM patient level strategy that was implemented for the patient was education. Teaching the patient, her family, and caregiver about her diseases and treatments has significantly enhanced the patient's overall health and well-being. She has been able to manage her symptoms well with the help of her caregiver and family at home. The patient has verbalized feeling satisfied with her care and current health condition. With assistance from her caregiver, she has been able to adhere to her daily prophylactic therapies for migraines and gout, which led to reduction in migraine and gout flare-ups. With her less frequent, milder headaches, she has been able to maintain her mobility and stay physically active. She is also eating healthier, which has positively impacted her weight. Moreover, the patient and her family are able to identify red flag symptoms of gout and migraines, though she hasn't needed to be readmitted as they have been able to manage her symptoms better since her last acute migraine exacerbation. She also hasn't utilized urgent care. Nursing case management effectiveness at system level. Planning and coordinating the patient's transition to a new IHSS provider or caregiver was the primary NCM system-level strategy that was implemented for ZG. The patient verbalized satisfaction after transitioning to her new IHSS provider, who also speaks Tagalog. ZG and her family are able to communicate effectively with the caregiver. The caregiver is able to manage and administer ZG's medications and supplements in a timely manner, which has been helpful in reducing ZG's migraines and gout flare-ups. The caregiver is also available to assist ZG with her IADLs, which includes preparing meals, housekeeping, and accompanying her to doctor appointments. Additionally, a home health nurse has been arranged to visit and assess the patient and her home environment once monthly. Durable medical equipment such as a walker and a cane have been obtained to assist her with ambulation if needed. And lastly, a neuromodulation device called Nerivio Migra, which is a remote electrical neuromodulation device for treatment of acute migraines, has also been approved for ZG. Overall, the new IHSS provider, as well as the home health nurse, and the durable medical equipment has helped improve ZG's health conditions and quality of life.